So good evening, everyone. My voice is clear. You can hear me. Uh, right. So just a bit of introduction about me. So I'm at the moment, this call is from London. So I'm one of the consultants, lead for neurodisability and epilepsy in North London. And I'm also the founder for Genius Lane Child Development Center in India. So my training mostly has been in the UK. So I did the pediatric training, and then I did pediatric neurology and epilepsy training in Cambridge. And then for the last 11 years, I've been a consultant, and I specialize in complex neurodisability, brain injuries, uh, epilepsy, and some of the neurodiversities, because it is a part of our work at Child Development Center. So the information I provide today is based on the evidence and the work that we do in the UK, and it is aimed to provide a clarity to you, so that you can help your child. Also, we provide you experience and expertise, which we have gained over a number of years. So when we say why autism should be recognized, so this is a huge question, because most parents don't want a label. And most parents say, okay, we just want to call it like a speech delay or maybe a hyperactive child, because that is more socially acceptable. And also they feel that they just want their child to be like other children. So from an early age, the word autism brings a real big panic for parents. So they are thinking, okay, whatever it is, we don't want the word autism. And this is not just in India. I see that in other countries, European countries, Middle East countries, Europe, UK. So usually it all depends on the society, and because if the society is um, very clear that they don't want any differences or diversity, then it becomes really difficult. And also the parents feel that they are being blamed uh, for not being a good parent, and sometimes the parents start blaming each other, so it becomes really complicated. But why should autism be recognized? This is our topic today. So if you are thinking that it is recognized because they have a problem and you want to normalize them, then you are not thinking the correct thing. If you are thinking because they need some help, you need to improve them, or they need to get some therapies, that's all incorrect. And maybe you can make the situation worse by doing that. So if you ask me who need more help if a child has autism, so usually autism children are very happy in their own um, little world. They basically have strong interest. They have strong interest, strong likes, strong dislikes. If they like something, they like it too much. If they don't like it, they just don't like it. So often it's the parent who need more help, because the child is not listening and they keep on giving the same instruction. I've seen parents whose voice have changed because they speak loudly all the time. So and some parents are very depressed and anxious about their child. So I feel that the diagnosis is not as much for the child, but more for the parents and more for the school. And I feel that diagnosis is more like a door. The door you open, and then you know what to do, what to expect. So instead of doing a general thing with the child, which is going to cause opposite effects in autism, it is important that the recognition of autism is not because the child has a problem, but because you will need to use these parenting strategies to get the best outcome. This is very important, that diagnosis is not for the child, but more for parents and more for school. So most parents who have a new diagnosis of autism or maybe even old autism, they think, okay, if the child start to talk, that's it. We've done it, is done. But autism is not speech delay. It is not mild, moderate, severe. And it is also parents thinking, okay, this is just behavior problem. My child has just got some behavior problem. But the behavior problem keep on changing. Sometimes the child is doing this, then doing this, then doing this, and it keeps on changing. So it's never ending, and it just keep on getting worse as the child grows. And then they say, oh, the child is only hyperactive. If only my child can sit, if only my child can sit and do the reading and writing, everything will be okay. So these are the wrong goals in autism. And if you choose anything with the wrong goals, you will get wrong results and you will be end up being frustrated. So do not do these mistakes. So when a parent come to me, often they are saying, okay, we just want resolution of behavior, that's it. And we just want improvement in speech, that's it. So they're just focusing on individual things, which is incorrect. When you treat a child with autism, that's not what you need to do. So most parents early on, so let's say diagnosis happen, so the mother is staying more with the child, she's seeing those difficulties. Other people will say, no, no, everything will get better. It's nothing to worry. So there could be a denial saying, okay, with time, everything will get better. That's it. So that's called denial because we haven't addressed the problem. We haven't used the right strategies and we say everything will get better. Or they can be panicked to do something, to get loads of therapies, loads of vitamins, loads of gut thing, loads of this thing, loads of that thing, get something. So people are thinking we need to do everything. We'll get everything for the child. And both things are wrong because if you're doing something without understanding the problem, then you will end up not getting a proper resolution and you will always see difficulties which I'm going to describe in this talk. So first of all, the diagnosis of autism does not mean a weakness of learning. It does not mean the child has got a learning disability. You need to teach the child how to sit. You need to teach the child how to look. You need to teach the child how to talk. All that is wrong. If the child has autism, they have usually a very strong visual memory, very strong. They will remember things from way back, and they have more strong memory than other children. Also, they have strong attention to detail. If they like something, they'll go into the detail of it. So, very important to not treat it like a learning disability. So, what happens is that if a child is neurotypical, you tell them, they listen, they follow, done. If the child has learning disability, you tell them again and again and again, they understand, done. You can use multisensory technique, you can tell them in different ways, job done. None of that work in autism. So if you're using all of those things, thinking your child has a learning disability, then you're doing a mistake. So if a child has a learning disability, they need a doctor to review the child. They need a psychologist as well. But learning disability is not in every child with autism. And usually a doctor will be able to find out if autism has associated problems like a brain injury, like a genetic problem, which is only in about 20% of children. But over the period of time, because of the gap, a lot of children, about 80% children, can be diagnosed as learning disability because they are not connected and because they are not listening, not following instruction. But they were born with strong memory, strong attention to detail. But over a period of time, all of those things might go away if wrong or incorrect strategies are used. So, why we recognize autism is in this slide. It's very, very simple. So, let's say if this is the brain and these are the ears. So, let's say if I ask you, what is your most favorite food? So, the information is like a road. And let's say the information goes from the hearing area to the memory. So if I ask you what is your most favorite food, it'll go to your memory and you will scan a lot of things in your memory. And then it'll go to your feelings part to say which is my most favorite. So you might have your most favorite food. And then it goes to your thinking brain where you say, okay, what do I tell the doctor? So it's like a pathway. So when a child listen or hear something, it triggers a pathway. And that pathway should go to their thinking brain, should use their memory, should use their understanding, and should use their understanding of social situation. And then it goes to the mouth so they can talk. So this is like a pathway which is executed. So when we say a diagnosis of autism, then from an early age, they will listen to what they are interested in and they might ignore what they are not interested in. So usually early on, you will see that they might have ignoring behavior. They might ignore things which they are not interested in. And because they are ignoring, a lot of the time, they might get overloaded with information. And that can cause a repetitive behavior, which is their adjustment to bring it down, or an irritable behavior. So, very important that more the child is ignoring, more will be their repetitive behavior. And the more the child uses this pathway gets stronger. So, the early intervention in autism is to recognize that this child has a thinking pathway, which is where they are interested in, and this child has an ignoring pathway. And the parent should be taught how to identify when the child is ignoring, what are the factors that can worsen the ignoring, and how do they understand and bring the child out to more in the green pathway. So, this is the core why children should be diagnosed of autism, because they can ignore information, and when they feel distress, they can show repetitive behavior or restricted behavior. So, restriction behavior means something they can do, but they will not do. For example, they can eat banana but not strawberry. So it's not they can't. There's nothing problem with the mouth, but they will not do it. Or something they don't need to do. For example, they don't need to play with the wheels of the car, or they don't need to look at the fan, or they don't need to switch off the light. They don't need to do it, but they do it. By doing that, they feel relaxed. That's their adjustment behavior. So when a child has autism, you address their adjustment behavior and you make sure they are not using the alternative pathway. Because if you see any child who is 12, 14, 20, basically is not about what they do. It's about using this pathway. And if this pathway is developed, sometimes they are there but not there. They're talking to themselves. Sometimes they feel like they have dissociated from the environment. Sometimes they have obsessive behavior because they can't think of other things. It's just the same thing going in a loop. It's like you're driving a car going in a roundabout, going round and round and round and round, but nothing meaningful is coming out of it. So, this is what you need to understand, that the diagnosis of autism is not to teach the child, but to break their ignoring and repetitive pathway. This is very important. So, if I ask you a question, if eating is an activity, behavior, or interest. So if you look at the autism diagnosis criteria by DSM and ICD-11, you will see these complicated words, and a lot of people don't understand what that means. They're just doing it. So let's say eating. So if somebody is hungry, they should be eating. That's a behavior. In autism, they can have an autonomic dysfunction. So that means because children are in a long-term distress, so they are not able to understand if they are hungry. So they either eat too little or eat too much. Again, the sleep is dissociated. So they can have autonomic dysfunction of sleep. So they can sleep too little or too much. They can talk too little or they can talk too much. They can play with something too little or play with something for hours. So it's not a problem with attention span. It's about their strong interest. So interest is a very big thing in autism. When children have strong interest and when you take it away, you hide them, you try and distract them by taking it away, it really gets a lot of their the red pathway. So very important to understand what is their interest and can we do things to regulate them. So if they are regulated, some of these difficulties of selective eating, strong interest, unable to sleep, selective playing will not become a problem. So usually if you see a child with autism, they are in their own agenda stage. Even if they're talking, it's their own agenda. They might be own agenda, controlling. That's what autism usually is. So if they are in the own agenda stage, our goal is to bring them to early communication stage and partnership stage. So problem is when they are own agenda, then if we don't identify, then we use techniques which are more direct, which are telling them what to do, repeatedly telling them what to do, which is incorrect. Because even if they do it, that will develop their red pathway, and you will see the main problem will be behavior. If you've been doing the things which is more repetitive, more therapy based, more kind of letting the child do, you will see the child will have a lot of adjustment behavior, which is more repetitive and restricted. So, very important not to use the wrong key in autism. Interaction should be to and fro. So, someone is talking, someone is listening, somebody is talking, somebody is listening. And also, the person should be able to understand other person's agenda and situation agenda. So, in autism, because they are focused on a very selective thing, like if you're focused on selective thing, you miss the bigger picture. So often they do not develop the understanding of the bigger picture, and they have strong reaction to small things, and that becomes a major impairment in parents life. So parents just want resolution of behavior without understanding what is happening. The child is not connected, the child doesn't have the bigger understanding, and because of that the child is developing a lot of rigid behavior, lot of restricted behavior, and lot of repetitive behavior. So I call it the 3R of autism. And if you can just address that, you will get a better outcome. And very important to address it, measure it to see what is happening, use the proper international criteria, and then only you can get a long term resolution. Otherwise, if you're just focused on activity like how much the child is talking or how much the child is sitting or eye contact, result will come and go, and you will be very frustrated. So if I ask you, if this building, which floor will you build first? So everybody will say, look, we'll build the ground floor first, we'll build the foundation board. But in the brain, so if you look how the brain works, so a child, a baby, when the baby is born, at around 3 4 months, they start showing attention to people. They start looking at people, they start fixing at people, they start smiling at people, and they start making a vocalizing noise, cooing, and a lot of people will come and give them cuddles. People love babies, they love, and babies love cuddles. But this basic attention becomes selective in autism. It's selective to their interest. And as you go against their interest, as you put a forceful environment around them without addressing the understanding, their attention become very narrow, narrow. And because this becomes a problem, that means their interaction and play become narrow and their understanding become narrow. All of that is becoming narrow, and that affects how they interact and talk. So often parents want to build the fourth floor, the fifth floor, without addressing how they connect, how they are looking at the environment. Do they understand the bigger picture? And this gap, if this gap is not addressed, this is going to cause a major impairment in the child's life. So you will never hear autism spectrum disability. You will never hear that. You will hear autism spectrum disorder because there was no disability. The disorder is this, the gap between their attention and listening and understanding. So very important that you understand where is your child listening, where is your child attention span, what are his interests, how can we expand it. If you can expand the interest, you will get a really good understanding. And important to know that autism is not about weakness. I see children with Down syndrome, so many other syndromes with autism, and because of autism they have strengths, otherwise they would have been even worse. So in autism they have strong visual preference, they can remember, and they can have attention to detail, and they can have strong likes and dislikes. So they can have strong likes and dislikes. So if you connect with them, you have to use their likes. And if you use their dislikes, they disengage with you. If you be forceful, they get more narrow with you. That's why the autism diagnosis is made, so that you can use the right strategies. So weakness in autism. So over a period of time, if children stay in a forceful environment, their attachment to people and environment becomes narrow. They just go in their own zone. So if they have gone in their own zone, something very bad we have done. We have traumatized them. So I see a lot of children in India because of neurodiversity, they are really traumatized. We feel that they are not good. We have to be strict with them. We have to teach them a lesson. We have to think that parents are not good. We are not nice to them. We don't understand their struggles. So very important to understand that the nature want people to be diverse. Nature want people to have different skills. The nature wants someone with a strong memory and strong attention to detail, because that's when new innovation will happen. Because not everyone can have a strong memory and strong attention to detail, but they might not have people skills. And for that, we have to understand that how do we develop that from an early age, not to be obsessed with normal. The problem is, if as a society, if we get obsessed with normal, then we'll have no innovation. So very important that we know that this is the weakness, but this is because the child is very selective. So might be selective with someone, might not be selective with someone, and that should be addressed rather than seeing it as a problem. And the result in autism should be their reduction of restricted and repetitive behavior. So if we have developed a good autism program, which basically we measure their communication to see where is their communication compared to their age. So let's say if they're communicating with you but not outside, we mark them to a level where they would do in a distressing environment. So communication would mean listening, attention span, understanding, speech. Then we look at their emotional regulation to see, can they understand their emotion? Can their body respond to their emotion? Do their body show how they feel? Very important. That's stage one. Until you have done the stage one, you don't go to stage two. And stage two will be how they understand other people's emotion. And stage three will be how they understand situational emotion and how they're able to negotiate is stage four. So everything in the brain is already programmed. If you don't do the bottom stage and you go straight to the top stage, it will not work out. The pathways will not develop and you will have a problem. And again, play is very important. Play uses alternate pathway in the brain. And these alternate pathway can be used to connect different areas in the brain. So play is very important. So early on, all children have exploratory play. They explore things. And if you see a child traumatized in autism, they have no interest. They don't want to play. They don't want to do anything. So play early on is exploratory play. If a child is exploring, good, explore with the child. The other thing that they later on to develop is more joint play, and later develop more functional play. By functional play, they relate the real life situation to a small miniature situation. And then they can do more pretend play, more social play. But if you go straight to social play without doing any of the things, then you'll be frustrated. You're not going to get there. So important to understand where they are, measure the brain. What are they doing? What are they doing when they are distressed? What are they doing when they are happy? Very important that we measure them. And very important is for them to understand how the world works. And all of them can be done visually. And in the UK, we use a lot of social stories, a lot of social situations. People are relaxed. So a lot of these things come over a period of time if the child is connected and you've done the basic work right. And sleep, that's where you might need a medical management, a doctor management. Sometimes they can have seizures. So important not to use very strong medication for autism, because usually most seizures, if they have a seizure which you can see, are focal seizures. And some seizures which you can't see, background seizures, epileptic encephalopathy, they're treated differently. So every child with a seizure, you need to find out what is happening, why it is happening, how do we treat it with the more specific medication, not with more general medication. Because sometimes I see that children are given one general medication, then two, then three, then four. So I see a lot of children on a lot of medication, and you don't get the outcome because the seizure medication is going to slow the child down. So very important that you're very careful what medicine you are giving to the child. And children are really using a lot of medication in India, which is really concerning. So very important that you take good medical advice, understand does your child need it. Do not just give supplements. Do not just give all of those things without measuring. If there is a deficiency, you measure it. If you've seen it, you give the supplement and then measure it again. Don't just give it. That ठीक है हो जाएगा. That's not what you want. Diet, again with the diet, there's lots of misconception of gut leaky and season free. And if there is a problem, celiac, season free, um, gluten, please check it. It can be checked. If it is a problem, check it, measure it, do it properly. Don't just give it. And the biggest factor in autism is the parental stress index. Because if you don't know what you're treating, if you don't know what state your child is, what level your child is, if you don't know what strategies you're using, if you have no way of measuring if your child is going in the right direction, you're not going to get any results. And children with autism will have autism specific behavior. You don't treat them, you use them to create treatment. So most of the ABA therapy should have been applied behavior analysis to see what the child behavior does and what you do. Sometimes I have seen that it's very repetitive. We just ask the child, you repeat, you repeat, you repeat, or make the child sit on a gym ball and do all of this. I don't know where it's coming from. So very important not to put your child through these things. Learning, the reason why I put learning is because children with autism will learn a lot, but application is the issue. So very important, you know how to use the learning into application into different things, how to broaden the horizon of the child. That's the goal, that's the key, and that's what the school should do, the therapy center should do, the child development center should do, the doctor should do, and everybody should join hand together to help the child and the family. So first of all, I want to tell you this key thing. Restricted behavior, the child don't want to do it, do not force straight away to get it done. First, develop the trust, develop a structure and routine, develop a way to manage the transition, show by your own example. Don't even want the child to do, they will do it. But even if you want them to do it, if you force them to do it, if you force them, it will become a phobia. If you want them to do it, it will become an issue. Use the autism techniques and you will see it will be easier. And be patient with the child. And repetitive behavior, often child is interested in something, we hide it. It's okay, fine, and then child get more interested in something else. I've seen children doing so much repetitive behavior, and parents, that's the main thing. Do not stop the repetitive behavior, do not stop it. Enjoy the repetitive behavior with the child. This is an opportunity to connect with the child, and that makes the child more relaxed. So if you're doing all the opposite things, is not worked out for you, the child has already developed a lot of red pathway, a lot of repetitive pathway, and the child is sometimes doing it, sometimes not doing it, sometimes doing it, sometimes not doing it. And then you're thinking, okay, we don't know if it is improving, but somebody's telling you, yeah, it's all good, it's all improving, but you have no way to find out what will happen 5 years down the line. So very important that autism was not a learning disability. Treated by the wrong way, you will get the wrong results. So the information I told you is available on my app. It's called My Genius Lane app, and you can connect me to the app. In India, our website is geniuslane.co.in. You can connect me to that. And also in the UK, we have website geniuslane.co.uk. We have professional training available for psychologists, for pediatricians, for doctors, for therapy centers. We have softwares which we can provide you, which can help uh, profile the child. And we have an app which can provide the parents what to do at home. So it's all developed over 10 years. Genius Lane has been around for 10 years, and we have been developing, presenting our work over 10 years. So we are very happy to share the work with you if you are interested. Thank you. I'm happy to take any questions. Yeah, I'm happy to take any questions. So I hope I was audible and you were able to hear what I said. Okay. So somebody's asking that many of the people ask me, your child is hyperactive and not speaking. So what are they doing in program? So usually you should see if your child is connected to other people, connected to situation. So if the child is not connected, of course they will be hyperactive. Of course they will be restless. So is hyperactive is not even the right word. The right word is child is restless and the child is restricted. So people are just using the wrong terminology. The child is restricted with talking, maybe also eating, maybe also playing, maybe also interaction, maybe also looking at people, maybe use of gestures. So, and restricted with other things like eating, sleeping. So restricted behavior is very common, less than 5 years. And after 5 years, it's a repetitive behavior. So from today, do not say your child is speech delay. Say my child is restricted, because it's not just the speech which is restricted, the communication, the activities, everything is restricted. So don't say the child has speech delay. So my child is restricted and my child gets restless in certain situations. So then if they have the treatment, then you go ahead to say, okay, how do you address it? So you don't address it just this speech delay and hyperactivity, um, getting all these compression therapies and joint compression therapies. It does relax them and they will start doing it, but how long are you going to do it? So very important that you develop connection, and there is no replacement to parent based intervention. So if parents can learn what to do with the child, you'll get the good results, but other people might not be patient enough to interact like that with your child. That's a good question, thank you for asking. Any other questions? So usually what I understand in India, that if a child has autism, usually occupational therapy is suggested. So occupational therapy is a good therapy for certain things like fine motor coordination or any adjustment the child has to make. So usually what they are doing is more sensory massage, which also relax them. But on its own, occupational therapy is not uh, a successful intervention if a child has autism. There's no replacement to parents-based things, and half the things that they are using they can be done at home by the parents. You don't need to send the child to a therapy center for that. Also, occupational therapy, the basis is getting the child do an occupation. So main thing is in autism, the child has a narrow attention span, strong interest. So they should focus uh, on widening their attention span. So single parent, I think, don't worry. Basically, when there are two parents, often they have different views. Often they are doing different things. So you're not single because you have your child. So important that don't feel you are single. Connect with your child. It's so much fun connecting with a child with autism because they're very predictable, very predictable. And once you use the autism strategies, you'll be laughing. The whole house will be laughing. So do not feel that there is an issue because you're a single parent. Important is when your child goes into the zone, recognize it. Important is to disturb your child, get your child out. Important is to use the autism communication method rather than direct communication method. And if you feel that you need help with that, you can contact Genius Lane and we'll be very happy to help you with that. But remember, there's nothing called single parent because you still have your child. Thank you. So thank you, everyone. And I'll just wait for a couple of more minutes. If there's no questions, then I will end this meeting. Okay, so if a child has autism, just look at their restrictions because their restrictions is their adjustment. So let's say a child with autism come to my clinic. So if they come to my clinic, they will just focus on maybe the kitchen toy or maybe the water tap or maybe the phone button or maybe my computer button. So they are restricted. So we need to measure how much restricted they are and we need to get their restriction out. So when they feel distress in a new place, new situation, they restrict themselves. That's the problem because that will stop their bigger understanding. So we need to measure how much restricted they are. We need to measure how repetitive they are. So they are sitting, if I see a child who is sitting and grinding their teeth, who is talking, who is saying some words which are not relevant, who is humming, all of that needs to be recognized because it's not what the child is doing. It's the restricted and repetitive behavior. And what they need is reciprocity. How do you reciprocate to the child? So reciprocity is like a tennis game. So the child has hit the ball at you. You don't throw 4 or 5 balls at them. You will not have a game. You look at the ball they are throwing, and the ball is what activity they do, and you hit it back. So we train you how to hit the ball back to the child, how to give a reciprocity and wait for the child to respond. And that's how the reciprocity pathway develops. Very important in autism. These are three things to address. The three R's in autism are the key to measure and early signs of autism, you will see that the child might have strong interest, strong memory, playing with certain things, strong personality, getting distress on the smallest of things, uh, and might be restricted, might have strong likes and dislikes. I see some children who are talking, they use the word no a lot. Whatever you say is a no. No. So that also becomes a problem. Okay. Yeah. So, but very, very important that when you're treating with autism, use the three R's as your guidance. And do not get into the trap of, there's so many people who are there to say, okay, hyperactive child, speech delay child. It's not hyperactive, it's restless. And it's not speech delay, it's restricted. Okay. So if there's no question, I'm happy to end this. Okay. One question is there. What are the best ways for parents to manage stress and maintain healthy balance? While, okay. So for any parent, trust me, any parenting is hard. If you have a child, uh, if you have a child, it's hard. So what you need to say is, okay, how do we interact, connect with them, and how can we be their role model? So as a parent, we are their role model. So number one is, do not show your frustration to your child. Do not show it because it's not going to be effective in any way. They'll get double frustrated, and they will learn it from you. So emotional regulation is the first thing. So do not regulate in a wrong way in front of your child. And number two is, look at the level of your child. So let's say your child is 4 years of age, and let's say your child is not listening, not looking, not talking. Then look at where is their developmental age. Are they like a 1 year old? So for 1 year old, if you leave them, they'll run around. So you won't say they are hyperactive because they are doing developmental appropriate things. So you would do things which are appropriate to their development. And mainly you need like a plan, and you need a good group, good positive people around you. So find good positive people. Do not have bad emotional regulation. Do not expect the unexpected. Expect what is to their level. Do what is to their level. You will see the level will change. And if the level change, then you get a positive response. Yeah. Any other questions? And that's why we do the targeted autism care, so that we know, okay, which area are the problems, what we do now, and then those areas achieved, then what we do now. And the parents can do it at home. Autism is very simple and easy if done properly. Okay, so I think we're done. Thank you so much. Thank you. Yeah, we can end this meeting.